It's true. I think you will hear about a different topic than what you usually hear, because we are going to talk about livestock and about livestock microbiome and native resources for animal health and antimicrobial resistance reduction. Because I didn't know really what will be my audience, I decided to make something a bit more broad that then we can discuss later more in deep when we have in the breakout rooms and in the questions afterwards. So, yeah, I believe that you already saw this picture. Sometimes a very complicated one with a lot of figures and with a lot of errors going around. Today, I make it something simple, just that we introduce the topic of the antimicrobial resistance. And we all get antibiotics at a certain stage of our life. Of course, if we get a lot of antibiotics, then we can develop some drug resistance bacteria in the gut. So, but not only us get sick, the animals also get sick, so they also get antibiotics and they also can develop this resistant bacteria. This, of course, it passes to the hospitals, it passes to the people that are around us, it passes to the ecosystems, it passes to the water, to the farms. So it's a huge problem that our world is currently faces. So it is really a global health crisis. So this AMR occurs when the microorganisms uh, change and become resistant to antimicrobial drugs, for example, the antibiotics, as I was telling you before. And some of this resistance emerges from misuse and overuse or exposure to counterfeit drugs. Not many years ago, we could go to the pharmacy and get an antibiotic because we were sick. Yeah. And maybe we don't even need antibiotic. For sure, you still hear people complaining, why the doctor didn't give me an antibiotic? Yeah, because this was the common treatment that we have faced. In the animals was even worse. And in some countries is still used, for example, in Brazil and China, the antibiotics were used as a growth promoters. So of course, animals were healthy by using it, but they were used as a growth promoters. We also know that there are some low concentrations of antimicrobials in the environment, so in the water that we drink, in the food, but we don't know what this long-term accumulation will affect the humans and also the animals. So as I told you before, the AMR is a critical issue for humans and animal health. And it is estimated that 1.27 million human deaths were directly caused by AMR in 2019, and the projections are showing that this number could rise to 10 million deaths per year by 2050 in case we are not taking any action on this. As you see here in green on this graph, mainly the sub-Saharan African countries have this rate, but high-income countries have nearly 50% fewer AMR tests than this. So it's still a big number, let's say it. So the widespread use of antibiotics in farming led to, the emergence of the resistance strains in animals that can be transmitted. And we know that over 70% of the antibiotics that are used globally are used in livestock microbiome. So we also know that low and middle income countries, for example, have this raise on microbial resistance due to intensive farming and the limited resources for monitoring and reduction of antimicrobial resistance genes. So despite all the successful efforts that some countries have done to reduce the antibiotic use in farming, the global consumption of the antibiotics in food-producing animals is projected to exceed 100,000 tons annually by 2030. This is 67% more than in 2010. And why this? So the intensification of animal farming. So there was a big shift from traditional farming practices to large-scale intensive operations in the middle-income countries. And of course, this involves the use of antibiotics to promote the growth and prevent the diseases. And why we have to intensify the animal farming? Oh, well, we have somehow to feed the world. So the global economic growth and urbanization drive this increase on the demand of meat and other animal products. So, of course, this led to use more the antibiotics. However, as you can imagine, this is a threat not only to the humans, but also to the animals. Yeah, because let's think as the animals as not as a human, but as something that needs health, to be healthy, that needs to grow properly under proper conditions, and that should use as less antibiotics as what we are trying to do to ourselves. So I want to give you some examples of successful interventions in high-income countries to address this AMR in livestock. For example, in the Netherlands, they have a strategy based on the reset mindset model, meaning rules, education, social pressure, economic tools applied to the cattle. And what this means that they have measures that are mandatory to be applied, and they have measures that are voluntary to be applied. And what they saw with these measures was a 47% reduction in antimicrobial use from 2009 to 2015. What they used was a very good enforcement in education to the farmers and educations to the people. Another case study was the Denmark with the Danish Integrated Antimicrobial Resistance Monitoring and Research Program, the DANAP, that monitors antimicrobial use and resistance, not only in livestock, but in humans, in soils, and so on. So what they observed was that they could eliminate critical important antimicrobials in pig production, for example, which is very important because are those that we really need for curing some healthy problems. And they increase the sensitivity to antimicrobials in E. coli from broilers, for example. So can we use these interventions in, for example, low and middle income countries? We might use them, but as you can imagine, we will encounter a lot of different barriers that will make these strategies a bit complicated to adopt. But these countries face limited interventions and increased risks due to the growing populations and the intensified farming practices. So what happened there is that there is a widespread use of antibiotics. So you can buy antibiotic in the counter without the need of a veterinary to give a prescription. And so then people use it for growth promotion and disease prevention. Also, the costs to ask for a veterinary to come and treat your animals in the farm are very high. And there are not so many veterinarians in the rural areas, as you can imagine. So this makes them just go and buy the antibiotic to give to the animal. And the smallholder farmers, they also prioritize short-term productivity over the long-term sustainability. So we should think that we have to identify solutions that can be used on the low and middle income countries to reduce the antimicrobial usage while maintaining the food production, because they have somehow to maintain the food production. But not everything is bad. So there are already some African countries with stricted rules about antibiotic usage, and they report already a 20% lower prevalence of AMR. Also, some farmers using native breeds and plants, and they could report a 30 to 50% reduction in antibiotic costs. And I will talk a bit more about this at the end of my presentation. And there are some education programs, for example, in India, that showed a 25% improvement in biosecurity practices among small-scale farms. So, what can we do more about this? Is there something that we can do? And you saw the word microbiome in my talk, in my title, yeah? In the last years, you have heard a lot about probiotics, and that probiotics maybe help us, to make our animals more healthy, and more resilient. And there are really some studies that show that probiotic supplementation in poultry can reduce infections and improve feed efficiency, because it's something important when you work with animals. And also that some proper microbiome management, so in the farms, reduce the excretion of resistant bacteria by 40%, minimize environmental AMR spread. And also that native breeds and traditional diets often support resilient microbiome. So this is what you start hearing or you start reading in the literature that is being used in the last years, recent years, as a possible way of addressing the AMR in livestock. But what is the livestock microbiome? For sure, all of you have heard a lot about human microbiome. And discard a bit what is the livestock microbiome. At the end, they are the same, but maybe with a couple of different microorganisms. So the microbiome is a diverse community of microorganisms, so bacteria, archaea, fungi, viruses, living in and on animals, and primarily in the gut. So I would say that livestock microbiome is a critical but often overlooked component of animal health and productivity. And I will explain. If you will work on the animal field, you will hear a lot about diets, improving the diets, improving the animals, improving the genetics, and so on. And you see the microbiome popping up much later and only now starting having a role and a connection to all this around the animal science field. Yeah. And why this? Oh, well, they support the digestion and nutrient absorption and improve the feed efficiency. Without them, that will not be possible. Yeah. So they will not eat what we are giving them. They produce essential compounds such as short-chain fatty acids that will support the gut health and overall energy of the metabolism. They enhance the animal immune system by stimulating immune responses and protecting against harmful pathogens. They inhibit, I'm very sorry, they inhibit They inhibit pathogenic bacteria by maintaining a balanced microbial community. And it's not static, it's influenced by a lot of factors. So our animals grow in an ecosystem, yeah, that shape their gut microbiota, the development of the microbiota, and also the composition of the microbiota from birth until later stages. Also, their bodies pass through significant alterations during their growth, and the microbiota must adapt to different stages of a development. So if you can imagine how fast a chicken grows. So this ecosystem, as I told you, is affected by different external factors. So what they eat, the host genetics, the gender, the health challenges that they pass, the housing conditions, the feed supplements. And I want for you to understand a bit better how this can affect the microbiome. I will give you some examples on these external factors. So regarding the diet and the feed quality, we know that inadequate diets can lead to gut microbiome dysbiosis. And here we can link to the humans. It happens the same with us. Yeah, if someday we just eat bad things, we will have an effect on it. A malabsorption of the nutrients in the intestines of the animals, it increases digestive passage rate. And the higher supplementation of nutrients like phosphorus and calcium will lead to inefficient utilization of natural resources. And we don't want that, of course. We know that native breeds have microbiomes adapt to local diets and environments, making them more resilient. And this is a host genetics effect. And that host genetic affects the microbiome. In fact, we have already studies that use the microbiome as a trait for improving the animals. Also, a lack of biosecurity leads us to inadequate disease control and a faster propagation of the disease. So we need proper practices, clean water, pest control, etc. Also, the poor sanitation, it makes our animals more exposed to pathogenic bacteria that will then cause them diseases. Overcrowded housing leads to stress, increases also the susceptibility to diseases. High temperatures and humidity makes that the animals eat less. So an abrupt weaning from the mothers, it leads to diarrhea and infections, for example, in pigs. The transport and the handling of the animals is also a cause of stress for them. And in early life interventions, the importance of the maternal microbiome passage and the colostrum feeding is not only, we don't talk only in humans about that, it's also a crucial step in the animals. And the worst is the overuse and the misuse of antibiotics. So the antibiotics will disrupt the balance of the microbiome by killing all the bacteria that is there, and they will cause the gut dysbiosis. So when you use antibiotic, the antibiotic does not discriminate between the harmful pathogens and the beneficial bacteria. Yeah. And this leads to this dysbiosis. What then happens? It reduces the drug efficacy, requiring higher doses or alternative treatments. It facilitates also the antimicrobial resistant genes exchange between the gut bacteria, increasing the transmission risk to humans and the environment. And also it promotes ARGR carry pathogens entering the bloodstream and the immune system. So the antibiotics alter the gut microbiota composition, select for antibiotic-resistant bacteria, and facilitate ARG accumulation. And this leads me to a definition that I want that you take it home. The resistome, that is the collection of antimicrobial resistance genes in a microbiome. And these common ARGs in livestock gut microbiomes are, for example, the tetracycline, that is antibiotics then used in farming, the macrolide resistance. The macrolide is usually used in livestock to treat respiratory infections. aminoglycosid resistance, beta-lactam resistance. So the environmental factors that can accelerate also this propagation and this spread is the disease, inflammation, diet, and exposure to ARG contaminated water, soil, and air. So it spreads then with a direct contact from human to animal, food consumption, and environmental pathways. So diet, antimicrobial use, and host genetics, they all influence this resistome diversity. And now I come back to a word that I say as a possible product to help in the AMR mitigation or to help in gut health development, that are the probiotics. And the probiotics are the live microorganisms which, when administered in adequate amounts, confer a health benefit on the host. So what they usually do, so they are capable of inhibiting the pathogens, so they will compete with harmful bacteria for nutrients and these additional sites in the gut, and they will reduce the colonization of possible antibiotic resistance bacteria. So we call it the competitive exclusion. They also produce antimicrobial compounds such as the bacteriocins, that are antimicrobial peptides that inhibit or kill pathogenic bacteria, and providing an alternative to the use of the antibiotics. They can also enhance the immune function because they stimulate the gut-associated immune system, so make the animals and the gut of the animals more resistant to infections. And some of the known species or the known groups of microorganisms that are used in probiotics in animal research is the lactobacillus, the bacillus enterococcus, and Saccharomyces istis. These are just a few examples, of course. And now the question is, do the probiotics really work as antimicrobials? So I show you that there are some studies in poultry about that. They show that they can reduce the prevalence of resistant bacteria by up to 30%. This was a study in E. coli. But there are also other studies that don't really show any difference. So more research is needed to assess what is the long-term impact on the ARG suppression. So what are the challenges and considerations that we should take regarding this? So they might be promising, but their effectiveness can vary depending on the strain, on the dosage, and also on the livestock species and the farming system. So we have a lot of external factors that might affect the work or not of the probiotics. But I think we can say that they could be a sustainable and microbiome-friendly strategy to reduce the antibiotic dependence, because we have some studies that show that. But we need to do some more research on this, and they should be part of a broader approach that includes improved biosecurity, native plants, and maybe more responsible antimicrobial stewardship. So, as you can imagine, once the antibiotics were banned, this market was bumping. You know, a lot of companies want to develop their probiotic product. But this has cost. This has a high cost. And the question is, can these low and middle income countries, so, and now going deeper in the rural areas, you have this family business, can they pay for a probiotic? Or are there other things that can be used instead of a probiotic, or maybe together with a probiotic when they get affordable for them. And this comes to also two other words on my title, the native breeds and native plants, because they offer natural resilience and antimicrobial benefits through their genetic adaptability and local environmental suitability. Yeah. And I have here some examples of native plants that can be used, and they are being used by the farmers. For example, the Moringa oleifera that improve the immune function and reduce the bacterial infections in the gut. The Acacia nilotica that is antibacterial, anti-inflammatory properties and helps also in the disease prevention. The Azideracta indica used for parasite control and gut health improvement. So what they do, they produce bioactive compounds like tannins, flavonoids, alkaloids that inhibit the growth of pathogenic bacteria. So they act as a natural alternative to antibiotic, even to have a health gut with a very good immune system also in the animal. So they strengthen the gut microbiome, reduce the pathogen load, and they reduce the need for synthetic growth promoters. So that's why some of the farmers include these native plants in the feed for their animals because they know that they will not get sick. But it's always complicated, and you either have experience and you know how much you should give, but there is a need for future research to determine the optimal dosages and formulations that to be used with these plants and ensure consistent quality and active compound concentrations in the plant-based feed supplements. On the other hand, we know that some indigenous breeds are naturally adapted to survive in challenging environments with limited resources and high disease pressure. So they have been over evolution, over generations, that allows these breeds to develop microbiomes that are adapted to local diets and also pathogens. And these adaptations have reduced the need of antibiotic. So we should think on expanding the native resource utilization, and we should think about using local plants, breeds that are tailored to the regional needs. And usually the traditional farming systems in these countries operate with the lower stocking densities. So this means that then the disease is not so propagated. And they minimize the use of antibiotics when we compare with the intensive poultry farming systems. So they emphasize the natural disease resistance, and which will make the breeds cost effective for small and medium scale farms. On the other hand, they also sell their products in informal markets. And the meat is often displayed, open, without refrigeration or proper sanitation. And of course, this lack of hygienic handling creates opportunities for contamination and opportunities for contamination with antibiotic resistance bacteria. So it's also a significant risk to public health. So we also need to target to have better market infrastructure with some cold chain logistics and education on hygienic practices to minimize AMR transmission risks. And I want to highlight you something because as you see, I didn't in fact show you a lot of things on the indigenous breeds or a lot of things on the native plants. And guess what? there are still not so many studies. So we know that there is transmission from farm to fork. We know that the animals get sick and get antibiotics, but we still don't know a lot of things. So we don't know the genetic diversity behind these indigenous and native breeds. So we need more studies on genetic traits and their links to productive traits. For example, egg laying, growth rates that are important in animal production. We need more microbiota studies. We need to understand how these indigenous breed microbiomes confer resilience and reduce antimicrobial dependence. How can they cope with the heat stress, for example? And we need more strategies for sustainable intensifying poultry production in sub-Saharan Africa without compromising the local ecosystems. And with this, I will come to the end of my presentation, and just to give you some notes about what do we need to do and what can be done. So we need to ensure food availability because we have high global demands, but we have to do this in a sustainable way. So we have to support the sustainable livestock production practices. And we have to use less growth promoting antimicrobials and improve the feed efficiency and also the nutrient utilization. With this, we can educate farmers. And one of the success of the program in the Netherlands were the education. We can implement regulations to control antimicrobial use in agriculture in all the world, not only in Europe and a bit in the United States. To promote improved hygiene and biosecurity measures, we have to understand the mechanisms that enhance livestock efficiency and health that are related to the microbiome, and work more on the development of alternatives to antimicrobials. Because if I will have something that will substitute antibiotic, of course people will give it to the animals, but there has to be something that is affordable to everybody. And they asked me also to say what global health research is. And interesting, it makes me think, because when we think about global health, we think always in the big things. And then we see people working in smiley little topics that make a difference already. So for me, will be the finding practical solutions to shared health challenges. And I think with what I told you today, the microbiome combined with native resources offers a sustainable solution for the reduction in the AMR to enhance the animal health and performance, and at the end, thinking globally to support health goals. And I really thank you for being on that side. And I'm happy then to join the breakout rooms and discuss with you further. Thank you very much.